thank you all for coming to my presentation. I will be presenting about my practicum semester at the Asian Health Coalition in Chicago, Illinois. So first off, I would like to start with a land acknowledgement because since I am coming in remotely from Chicago, we are on the native Potawatomi territories of the Chicagoland area. So my practicum was at the Asian Health Coalition in Chicago, and this organization strives to improve the health and wellness of African American, Asian, and Pacific Islander and other immigrant communities of color around Chicago. I had the amazing opportunity to work with one of my supervisors, Naomi Louie, in the Hepatitis B project during this program. So my first practice scenario was creating different flyers for Hepatitis Awareness Month, which this year is in May of 2022. And these flyers helped me with my creative and critical thinking skill because not only was it important to put key information in these flyers, but it was also important to make them easy to read and easy to understand. So it was really fun creating these and adding all the icons and colors and that kind of thing. It was very creative and I really enjoyed it. And this also helped me with my cultural safety and competence skill because since the Asian Health Coalition works with many diverse communities around Chicago, it was very important that we addressed all these communities and made them feel seen and identified in these flyers as well. My next practice scenario was working with the MyMaps referral maps, and they look very similar to the image on the far right. And in these maps, I researched which clinics around Chicago accepted patients with insurance, without insurance, both, and which clinics translated in languages other than English. So this was very interesting because it helped me realize how few clinics accept patients without insurance and what a long way we have to go in the US healthcare system to make sure that all patients get the healthcare that they need. And this really helped me with my community systems and navigation skill because it helped me navigate different websites, telephones, and just made me understand how to better contact these healthcare organizations for the information that I needed. So one of the PHSP values I especially learned during my time here was the value of cultural safety. And since the Asian Health Coalition works with many different diverse communities, it was extremely important to follow cultural safety measures and make sure that each community group felt represented and respected. And the knowledge area I especially worked with was the social and life course determinants of health and health inequalities. And due to my practicum organization, working with many different populations across Chicago, I was able to learn firsthand about many of the health inequalities around Chicago and the lack of healthcare accessibility for those that do not have insurance. And this practicum helped show me how people's access to healthcare can be due entirely to their financial status, which I did know slightly before, but this really implemented that fact for me. The call to action that especially resonated with me was number 18, which states, "We call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centers to address the physical, mental, emotional, and spiritual harms caused by residential schools, and to ensure that the funding of healing centers in Nunavut and the Northwest Territories is a priority." And this really resonated with me because in a lot of my BA program, I had the opportunity to learn about Indigenous health and wellness and learn how different community groups might feel more comfortable with alternative medical practices that might not be the widespread available practices used in hospitals and that kind of thing. And since Chicago does have a wide range of ethnic groups, it made me realize that maybe we do need more medical practices to be used for alternative healing measures and that kind of thing to make sure that each ethnic and community group feels safe and respected as possible. So key insights from the practicum and the program was learning what I was doing well and what I needed to improve upon. One of those things was just to make sure I was taking notes during meetings and asking questions. And since I was working remotely, this was something I had to continuously remind myself about. Realizing what I would like to do for my future career, I realized how much I love working in a collaborative environment like this one and working with communities and feeling like I have the ability to try to help communities in this area was really amazing for me. And learning about American healthcare and the health disparities many communities face, especially those without insurance or underinsured, was really crucial. And learning about the importance of cultural safety and practicing strong communications with my team members was also very important, especially in a remote setting. And I would like to thank the Asian Health Coalition so much for this wonderful opportunity, especially my practicum supervisors, Aaliyah and Naomi. It was truly the highlight of my entire time here, and I could not have asked for a better practicum. It completely surpassed all of my expectations, and I just learned so much from it. So thank you so much to the Asian Health Coalition. And thank you so much to all my professors at the University of Victoria and all the staff that made my university experience so incredible, especially Heather and Jaime and also Natalie. I was truly blown away with just how helpful everyone was and how kind. So thank you all so much. Here are my references and any questions if anyone has any.